Australia is recognised as having one of the best healthcare systems in the world. But with our extensive health prevention and promotion strategies come challenges. Access to care, cost and our ageing population means whilst we're living longer, we're also living longer with disease and disability.
I think the major challenges are technology and ageing. And the technology challenge is we can now do more and people expect more. I think the challenge for the health system and for us as health service researchers is to demonstrate that health is an investment rather than a cost.
With such high demands and system pressures, the AHSRI team here at the University of Wollongong is focused on achieving health service systems research and providing real-world solutions.
The Illawarra is a perfect microcosm of Australia. We are a very self-contained population. Most people receive all of their healthcare here. We have 9 public hospitals, a network of private hospitals, etc. And we're very self-contained. And that means we can undertake research here in the Illawarra and we can generalise the results to the whole of Australia.
We have a number of partnerships with the University of Wollongong. One of those partnerships is with AHSRI, the Australian Health Services Research Institute. This is a partnership where together we've created CRISP, which is very much about health research for Illawarra Shoalhaven population. So we're dealing with a lot more complexity in the system. What this enables us to do is to couple what's happening within our population to look at, well, what is it that we need to look at as a health system to actually more effectively support those people or help them improve their health status and how they are.
One area in particular they've homed in on is high attenders, that is, people who attend the emergency department regularly.
So what we've seen in health and in the emergency department is an exponential increase in the number of patients who are presenting. So even in the last quarter we saw an increase of almost 9% in the number of patients, and that's been year on year. It's not patient-centred having to come back to an emergency department 7 or 8 times in a 12-month period. And so by working both on the hospital side, which is a limit in resource, and working on the patient side, which is whatever's best for the patient, we can come up with some really good outcomes.
Through longitudinal studies, analysing millions of records and working closely with frontline service providers, AHSRI has been able to influence change at ground level.
We have a real commitment to a philosophy of collaborating closely with all of our stakeholders, right from senior executives in provider organisations, through government, right down to staff on the floor working in aged care homes or in hospitals, for example. Our approach to collaborating with stakeholders across the sector, we think is really important to develop a good understanding of the issues and allows us to identify appropriate solutions in the research that we're undertaking.
AHSRI has been extensively involved in aged healthcare reform processes over the past several years. Collaboration, again, a key factor in their success. Having worked with a range of aged care providers over many years, AHSRI research has resulted in positive changes to facilities both in the Illawarra and around Australia.
We've been trying to develop a way of thinking about care-related quality of life. So we've been really trying to focus on research methods that help us to understand different areas of life that might be important with people with dementia and how we can measure and assess those.
One particular area being addressed, communication issues hindering patients from making decisions around their own care.
We've been focused on using new types of communication and measurement methods, things like talking mats or easy read questionnaires and surveys that allow people with dementia to communicate both with pictures, with gestures and with words around things that are important to them.
It's through results and changes like these that AHSRI and the university see the most benefit of the work they do.
The legacy for AHSRI is more than just traditional academic metrics. Every academic wants to be published in high quality peer-reviewed journals, and we want to do that too. But the legacy issue for AHSRI is we actually want to improve the health system and we want to improve care for patients.